You know that feeling when the world just seems to be spinning out of control? Most of us think of vertigo as, a purely physical thing, some kind of glitch in our inner ear. But what if I told you that the key to steadying your body might actually be calming your mind? Today, we are diving into some really fascinating research that shows just how deeply our emotions are tangled up with that physical sensation of vertigo.
Yeah, it's a super disorienting and honestly a pretty scary experience. And that feeling that the world just will not stop spinning, that's exactly where we're going to start. So, here's how we're going to break it all down. First, we'll get a solid handle on what vertigo is physically. Then, we're going to uncover this really unexpected link to our emotions. After that, we'll dig into the actual data that shows how our feelings can literally amplify the dizziness. And finally, we'll explore what this all means for a new path to recovery.
Okay, so first things first. Let's get ourselves grounded in the physical reality of what we're talking about.
So what is vertigo really? Well, it's way more than just feeling a little off balance. It's actually the #1 symptom of something called a vestibular disorder. You can think of it like a major miscommunication between your inner ear's balance system and your brain. And the study we're digging into really highlights just how serious this can be. I mean, it can mess with everything from your vision to just being able to walk across a room.
And it's not a one-size-fits-all kind of thing either. Researchers have actually broken it down into 3 main types. You've got acute, which just hits you out of nowhere and lasts for over a day. Then there's episodic, which kind of comes and goes in waves. And finally, chronic, which is this nagging dizziness that can stick around for months or even years. Now, you're going to want to keep these 3 types in mind because they're going to be super important in just a minute.
All right, so we've got a handle on the physical side of things. Now let's get into the really interesting part, that surprising link to our emotions. Because it turns out this physical experience doesn't just happen in a vacuum. This is where the story gets really good.
And that brings us to the big question, right? Is vertigo just a physical problem? Well, the research we're looking at says pretty clearly, nope. It looks like our inner ear and our inner emotional world are way more connected than we ever really thought.
The researchers Feng and Zhang, they didn't mince words. What they found was that anxiety and depression aren't just, unfortunate side effects of feeling dizzy all the time. No, they're active risk factors that can actually make the vertigo itself so much worse.
So, how common is this connection we're talking about? Well, in their study, which looked at 330 vertigo patients, they found that about 1 in 8 of them also had anxiety, and it was pretty much the same number for depression. That is a huge overlap, and it shows that these conditions really do seem to go hand in hand.
But here's the kicker. It's not just that these things exist at the same time. Let's look at the actual numbers, the data, that shows just how much our emotions can crank up the volume on those physical symptoms.
Okay, this is where it all becomes crystal clear. This is not a passive thing. The study found a direct, totally measurable link where your emotional state is actively making the physical symptoms worse. It basically creates this awful vicious cycle.
And the scale of this is, honestly, it's staggering. Get this. Patients with vertigo who also had anxiety were more than 4.5 times more likely to have severe symptoms compared to patients who didn't have anxiety. That is just a massive, massive difference.
And it's the same story with depression. Patients with depression were almost 3.5 times more likely to have their vertigo labeled as severe. It really is like our emotional state is the volume knob for how bad the dizziness gets. Okay, so remember those different types of vertigo I told you to keep in mind? Well, here's where that comes in. The impact of your emotions isn't the same for every type. For folks with that episodic come-and-go vertigo, both anxiety and depression are huge amplifiers. But check this out. For chronic vertigo, anxiety has an even more dramatic effect. We're talking nearly 6 times more likely to have severe symptoms. That's incredible.
So, with all this data, what does it actually mean for treatment? That brings us to our final and I think most important section, figuring out a new path to recovery, one that truly brings the mind and body together.
The researchers point out something pretty crucial. Even with all this evidence staring us in the face, a patient's psychological state is often completely overlooked by doctors. And that's a huge gap in how we treat vertigo, right? It leaves people feeling alone and can seriously get in the way of their recovery.
So based on everything they found, the researchers are suggesting a much more holistic approach. It's pretty simple, really. Step 1, screen every vertigo patient for their psychological status. Make it routine. Step 2, build emotional support right into the treatment plan.
We're not talking about treating two separate problems here. It's about creating one solid rehabilitation program for the whole person. And the goal? Better results, and of course, a much, much better quality of life. And the best part is, they stress that this is a totally practical change. They're just calling for using simple, standard screening tools to make this a normal, efficient part of caring for someone with vertigo.
Which leaves us with this one big thought to chew on. This research really challenges us to stop seeing vertigo as just some simple mechanical problem. It's a complex mind-body experience. It tells us that a truly effective rehab program has to look beyond the spinning in our ears and also address the anxiety in our minds. It really makes you wonder, to steady the body, do we first have to calm the mind?